Increased health plan competition. Increasing the health plan rates? That's odd. Hi, I'm Kevin Canals with InsureMeKevin.com. And in 2022, consumers for individual and family plans through Covered California and Off Exchange will find that the subsidies through Covered California have decreased, even though there are more health plans to choose from. And how this all comes about is that one of the new entries, Bright HealthCare, will be displacing Blue Shield as the second lowest cost silver plan. And not only will they be displacing them, they will be 15.9% less expensive than Blue Shield. Now, the second lowest cost silver plan is important because it is in the formula for determining the subsidies. The Affordable Care Act keys off of the second lowest cost silver plan to make it affordable for the household at the income. So there's various consumer responsibilities at the very upper end. The Affordable Care Act, at least through 2022, says that no household should spend more than 8.5% of their income on health insurance, specifically the second lowest cost silver plan. So if the second lowest cost silver plan is 10% of the household income, then the subsidy is the difference, that 1.5% between 8.5 and 10%. Well, if that is $1,200, then Covered California takes that $1,200 difference, chops it up into 12 equal increments, and sends $100 a month to your health plan to lower your monthly premium. Usually, the difference is much larger and the subsidies are much larger. But if the second lowest cost silver plan is less expensive, then the subsidies aren't as large. So in 2022, I did a comparison between 2021 and 2022 in Contra Costa County at different ages. And the Bright HealthCare HMO will be approximately 15.9% less expensive than the 2021 Blue Shield Silver PPO. So for a person who is 60 years old, in 2021, the Blue Shield PPO was $1,287. The Bright HealthCare for 2022 will only be $1,083.23. So that can be a real big difference, because then if we look at Contra Costa County, and then we just assume, I just put in a $35,000 per year income. That's what I was using. So for that 60-year-old at $35,000, their subsidy in 2021 per month was $1,142.81. It will drop to $942.24. $200 a month. That's a lot. Now, if that individual stays with Bright or the second lowest cost silver plan, they won't notice a difference. But Bright's a different health plan. It's an HMO. Blue Shield was a PPO. If they had a Blue Shield, their doctors may not be in network. So there's all kinds of complications if people want to keep their health plan and they do not want to switch. And I'm not saying that Bright isn't a good health plan, and it may work wonderful for people, but folks are going to have to look at it and determine whether that second lowest cost silver plan, which is the Bright, is the right one for them. Now, it just doesn't affect people in the second lowest cost silver plan. Looking at a gentleman, 40 years old, in Contra Costa County, making $40,000 a year. The Kaiser Silver Plan, he was receiving a subsidy of $395.20. That made that Kaiser Silver Plan $89.65. Kaiser is the least expensive silver plan over in Contra Costa. For 2022, the Kaiser plan for the 40-year-old individual will go up to $201.91 because the subsidy drops down to $302.30. So a big jump. Now, the way the subsidies work, once it's been calculated, you can apply it to any metal tier level and or any carrier. So, you know, you may get $300 a month. You can apply it to a bronze plan, and it may cover all of the premium. Or you can apply it to a gold or a platinum plan or the most expensive silver plan. It doesn't make a difference. Now, some people may have an additional hit if they were receiving the extra subsidy because they received unemployment insurance benefits in 2021. The American Rescue Plan gave an additional subsidy to people who received unemployment benefits in 2021 for at least 1 week. They artificially dropped the income in covered California so that the subsidy would get larger. And so many people were paying $1 or, you know, per silver plan. That's going away in 2022. The subsidies will be based on that estimated income. So that's going to be an increase. The rates that I was calculating year to year aren't really good because we're all a year older. So your rate is going to go up just because you're a year older, probably 2 to 4 or 5%. So right there you have a hit. And overall, throughout all of California, if the second lowest cost silver plan stays flat or decreases, but your plan that you have chosen has an increase, that amplifies the smaller subsidy, or what you feel is a smaller subsidy, because of the higher health plan rate. So it's going to be really tumultuous for many people in Contra Costa County to see that their subsidy has decreased so much. And it is all because of competition in a new, lower cost, second lowest cost silver plan in the marketplace. That's all kind of complicated. If you have any comments, please leave them below. You can go to my website, insuremekevin.com, find my contact page, send me an email, give me a ring, and I'll try and explain it a little bit better. But that's kind of what we're facing in 2022, and it could be particularly bad for people in Contra Costa County. Sorry about that. So for Insure Me Kevin, I am Kevin Knaus.